Your name, your position. Okay, good. So my name is Abraham Rugo. I'm the Executive Director of Bajeti Hub, and we work to support citizens in all their different forms of organizing to engage with public budgets. And therefore, our big question is for you to ask, where is my money going? Because each of us pays taxes, whether directly or indirectly. Directly, those who pay through their payee, their income tax, but also indirectly through VAT, through other excise taxes of the goods we buy. And here we are talking about health financing, and an important point to say is that if you take your 100 shillings and assume the 100 shillings is all there is to pay for healthcare, out of that 100 shillings, about 23 shillings comes from Kenyans' pockets. So in other words, is what we call what you pay. You co-pay at the facility, or you pay for your services, as it were. 60% comes from our taxes, our government support, whether it's through direct budgetary support or through the contributions that we make to NHIF and the like. And only about 15 or so percent, if not less, is coming from well-wishers, development agencies and the like. And therefore, that is to say that already about 85% or 85 shillings out of that 100 shillings is money that we actually give as Kenyans, through the different, whether the contributory or whether through our taxes. And that means then the big question is, where is this money going? And those are the questions, therefore, of efficiency, of dealing with corruption and abuse that have been raised. The Auditor General has raised those questions. And we know very well a good portion of it goes to pay salary of doctors and nurses and other health workers. But there's, of course, a question of, are they always available in the facilities, or are they also engaging in commercial services, when they should actually be providing public health services. And then, of course, there's also, of course, the question of the quality of services, accessibility of that service. These are the critical questions that we are asking as we gather, as we discuss. These are the questions you should be asking your member of parliament, your MCA, to ask within the assembly. Because those are the people who are responsible for ensuring that there is accountability for how public resources are spent. Kenya is sustainable, yes. USAID and other partners have been playing a big role, but the truth is that that role was already on a decline. USAID is just that the plug has been pulled in totality, but already there was a decline. There was already a decline, and the reason for that is that Kenya is a middle-income country now, and therefore it's expected to take care to sustain most of its expenses. So we are sustainable. We are fully sustainable. If we pulled every dollar and pushed it to what it is supposed to be, we actually are able to provide. It's only that some of those, for instance, HIV, TB, and malaria, which already government had been informed to start already budgeting for them. Some of them have not been factored in. But once, by and large, we should be able to meet our own expenses. I don't think there was anything about upgrading, because upgrading is just about improving the systems, the interaction between the service provider, because NHIF is an enabler, is a purchaser. You make a contribution, and then it purchases for you that healthcare when you need it. In other words, it's an insurance, and that's why we use the word insurance. And a lot of the questions that were being raised around NHIF were transparency in nature, were management in nature, why are you paying inflated costs to facilities and the like. Those are the only things you needed to fix. You still can. There were how many? There were almost 73 schemes within NHIF, that were providing for different categories. All you needed, in my opinion, was basically to be able to expand and ask, what problem are we trying to solve? Because if the problem is some people who need to be reached are not being reached, then you find a mechanism of reaching them. The problem of transparency, of corruption and abuse of office, that when you deal with it as a rule of law matter. So I worry that we have gotten into a very expensive experiment of trying to create all these different funds with different, with management, with overheads and administrative expenses and the like. Yet you could have put that resource directly to providing healthcare. And healthcare is not provided by NHIF. It's provided by health facilities, who you need then to be able to say, as a purchaser, because then, as I've said, SHIF, NHIF, PHC, they purchase for you. When you go to hospital and give that card, somebody else pays, and that somebody is NHIF or SHIF for that matter. It's about tightening. It's about ensuring there is quality. It's about ensuring that there is accessibility of that service. That still remains my position. Whatever direction we go, we must make sure that Kenyans are getting the health service they require because they are making a contribution. Whether they are contributing directly to SHIF, to SHA, or not, they are still paying taxes. Thank you.